Good afternoon. What is psychiatry? This may seem like a completely theoretical question, yet it has great practical significance. The practical significance of this question lies in the fact that a significant number, if not the majority, of both our fellow citizens not related to medicine and medical workers, including paramedics, have a rather vague understanding of who psychiatrists are and what they do. Well, let's start with a brief historical excursion. In fact, psychiatry, like many other medical disciplines, emerged as a separate field, so to speak, quite recently. It was only at the end of the 19th century that psychiatry actually appeared as a separate medical science, a distinct discipline. Nevertheless, since ancient times, people have noted the presence of mental illnesses among their fellow citizens and acquaintances. Thus, Hippocrates actually describes them Hercules' disease, epilepsy, melancholy, and other mental disorders. Following the ancient period came the Middle Ages. But like all other sciences, during this period, medicine in general, and psychiatry in particular, fell into significant decline. People with mental disorders began to be considered possessed by the devil and were burned at the stake, which in fact ultimately did not affect their population. Then came the Renaissance, a gradual, so to speak, democratization of society. However, mentally ill people only received their status as mentally ill individuals, rather than being considered demon-possessed or beasts during the time of the Great French Revolution. In fact, thanks to the great psychiatrist Dr. Philippe Épinel, the chains were removed from mentally ill people and they were recognized as patients. Before that, they were kept like wild, insane animals. However, even though they were given back the status of patients, there were still no effective treatment methods. Repeated attempts were made to find something that could somehow alleviate the condition of people, or at least bring their behavior to some norm. But neither mechanotherapy nor similar methods in general yielded any significant results. And only, as I already mentioned, by the end of the 19th century, did some positive shifts begin to appear. And here arose a very amusing is probably the wrong word, interesting phenomenon. Since the beginning of the 20th century, we have observed a steady increase in the prevalence of mental illnesses. Moreover, this increase is not due to the major psychoses, and we will discuss the difference between psychotic disorders, psychoses, and non-psychotic disorders, neuroses, in our future lectures, but rather due to non-psychotic disorders or neuroses. Moreover, initially, psychiatrists dealt only with psychoses and illnesses, like depression, asthenia, or neurasthenia, as it was more commonly called back then. Anxiety disorders, eating disorders, and everything else were handled by therapists. But gradually, this entire non-psychotic neurotic group of disorders, which is very large, began to shift under the purview of psychiatrists. And if, as I already mentioned, the number of psychoses per 1,000 people is more or less constant, the overall prevalence of psychoses in the population is a constant thing. As I already mentioned, neither the repressions against mentally ill people during the Middle Ages, nor the eugenic purges during Hitler's rule in Germany led to a change in the number of people with psychoses. From 1.5 to 2.5 to 3% of the population suffer from psychotic disorders, psychoses, and this figure is practically constant. However, depressions, anxieties, asthenias, panic attacks, eating disorders, psychosomatic disorders, these have increased very, very, very significantly. Currently, the World Health Organization states that the prevalence is around 20% of the population in general will experience these illnesses at some point in their lives. Moreover, only 1 in 10 will seek help, while 9 out of 10, 90%, will continue to suffer on their own and cause distress to those around them. This is a huge conglomerate, and the 20% figure pertains to the entire population. In specific groups, such as visitors to outpatient facilities, medical institutions, and inpatients, this percentage reaches up to 50, even 70%. That is, the majority of patients suffer from various psycho-emotional disorders. But again, most commonly these are depression, asthenia, and anxiety. Not to mention addictions. Well, naturally, psychiatrists cannot cope with such a large group of the population. Especially since, as I already mentioned, only 1 in 10 seeks help. Therefore, one way or another, 9 out of 10 of these people come into the view of general practitioners, into the field of activity, into the sphere of activity of non-psychiatrists. They turn to emergency services, they go to clinics, they visit hospitals. They are treated for a wide variety of diseases, but nevertheless they often have predominant pathologies, specifically psycho-emotional disorders. Often this psycho-emotional disorder is neither identified, diagnosed, nor established as a diagnosis that requires treatment and correction. That is precisely why it is important to understand what psychiatry is and how it differs from related disciplines. Which related disciplines? Well, first of all, it's neurology. In fact, psychiatry and neurology have common roots. Initially, it was one discipline, psychoneurology. But, nevertheless, they eventually separated. Neurology deals with somatic diseases, somatics, physics, and the physical health of a person. It simultaneously has diagnosable and codable diseases both in neurology and psychiatry. For example, Alzheimer's disease has coding both as a neurological diagnosis and a psychiatric one. However, the main difference between a neurologist and a psychiatrist is that a neurologist deals with the somatic, physical health of a person related to the nervous system. A psychiatrist deals with mental, psychological health, behavioral, emotional, intellectual issues. Issues related to thinking, will, but not with somatics. Again, psychosomatic disorders is also a very interesting area because there, the reverse situation occurs, where a mental illness manifests only through somatic complaints. And we see that seemingly a person presents complaints about their physical, bodily health, but in reality, treatment is needed for their psycho-emotional state. Another specialty that lies simultaneously in both psychiatry and slightly separately is psychotherapy. There is a problem here. The fact is that a psychiatrist is always a doctor, a psychotherapist. A doctor psychotherapist naturally is also a doctor. Moreover, one can become a psychotherapist only after first becoming a psychiatrist. But at the same time, the term psychotherapist can also be used in relation to a psychologist who is not a doctor and does not have the right to diagnose. Therefore, when we say psychotherapist, it is always necessary to clarify. Is it a doctor psychotherapist or a psychologist psychotherapist? Their authorities and knowledge are completely different. As for psychology, in my opinion, a psychologist should possess the highest qualification. They should be knowledgeable, not only in psychology, that is, the mental characteristics of behavior, development, formation, functioning of a healthy, normal psyche, without any psycho-emotional disorders. But they should also be fully versed in psychiatry, that is, they should be able to recognize illness if it is present in a person. But unfortunately, not only in our country, but also worldwide, the situation is such that one can become a psychologist very, very easily by mastering a couple of templates and starting to apply them, regardless of whether a person has a mental disorder or needs diagnosis and treatment. Well, just because the person knows only a very, very, very limited area in the field of healthy psychology and tries to apply it to absolutely all cases, despite the illness. How should it be? If a person has a psycho-emotional disorder, if they have a diagnosis, then first and foremost, they should be examined, prescribed treatment and treated by either a psychiatrist or a psychotherapist. Only then, in addition to this, can a psychologist be involved, primarily for the rehabilitation of the patient. But under no circumstances should treatment begin with a psychologist. What else should be mentioned? It is worth noting such a mysterious, there's no other way to put it, specialty as a psychoneurologist. The fact is that once upon a time there really was such a specialty, psychoneurologist. After that, in order not to scare people with the word psychiatrist, this very psychoneurologist appeared on clinic signs. For several decades now, the specialty psychoneurologist has not existed. Nevertheless, despite the fact that the specialty psychoneurologist is absent in Moscow, there exists a psychoneurological hospital. Although, by all laws, by all standards, it is a psychiatric one. It predominantly treats people with non-psychotic disorders. That's understandable. But again, the use of the term psychoneurologist, the specialty psychoneurologist, implies precisely a psychiatrist. Well, why it still exists, I don't know. It's of slightly less interest to us, but nevertheless, as a fact, it's good to know about the existence of such a specialty as a psychiatrist-narcologist. A psychiatrist deals with specialties that classify diseases, diagnoses that are classified by the International Classification of Diseases from F0 to F99, starting from diseases related to organic brain damage, ending with mental disorders of unspecified genesis. A psychiatrist-narcologist, in theory, deals with diseases classified from F1 to F19. That is only 1/10 of the volume that a psychiatrist should know. At the same time, a psychiatrist, in theory, should not deal with diseases that are classified from F1 to F19. So, this little piece, 1/10 of psychiatry, which concerns addiction, was carved out and designated as the domain of psychiatrist-narcologists. Again, to become a psychiatrist-narcologist, one must have a basic education in psychiatry or psychiatry-narcology, which again is not fundamentally different, because dealing with addiction separately without knowing psychiatry or practicing psychiatry when half of the acute male wards are occupied by patients with alcoholism, with alcoholic psychosis, is of course impossible. Nevertheless, it is a separate specialty. Okay? And by the way, it exists in few places around the world, but here in Russia, we have it. And as a treat, so to speak, let's leave such a direction as anti-psychiatry. The followers of this movement believe that mental illnesses do not exist at all. That is to say, there is no psychiatry at all, no mental illnesses at all. There are these fascist psychiatrists who, in conspiracy with international pharmaceutical corporations, turn healthy people into patients. Prescribe them various medications, turning healthy people into vegetables, and torment them in every possible way. But, to be honest, the emergence of anti-psychiatry is understandable, because when the boom in pharmaceutical production began, when the first psychotropic drugs appeared, and when antidepressants finally reached the level of being among the most profitable drugs to produce, then, of course, pharmaceutical companies made tremendous efforts to ensure that the diagnosis of depression was as broadly defined as possible. At the same time, to say that people suffering from delusional hallucinatory disorders are not ill, well, of course one can. Everyone has the right to their own opinion. But it's very difficult. In terms of whether it's an illness or not, it's probably best to ask the relatives of such patients and the neighbors of such patients. And to the followers of anti-psychiatry, I would recommend spending a week or two in a ward where there are non-patients with these diagnoses. Well, how long they can last, how they will endure it, I don't know. Naturally, as I mentioned before, the prevalence of non-psychotic disorders has significantly increased in recent years and has reached 20% of the population. In the forecast, over the course of a lifetime, every fifth person will experience a psycho-emotional disorder. More precisely, they are already experiencing psycho-emotional disorders. Now, in certain groups, this percentage is even higher, and naturally, all these people are seen by psychiatrists, should not be treating. Well, firstly, because only 1 in 10 will seek help. And secondly, of course, prescribing tranquilizers, antipsychotics, antidepressants, mood stabilizers, and similar medications to everyone is completely unnecessary. Many of these people can quite well be treated. Their condition can be adequately corrected with psychotherapeutic methods, even without the use of psychotropic drugs. And here, probably, one should act according to the principle of reasonableness. If we see manifestations of psychosis, psychotic disorders, and we will talk about these signs in our next lectures, then of course, the question of providing help, the question of the severity of these phenomena does not arise. They are obvious. However, if we are talking about non-psychotic disorders, about neuroses, yes, such as depression, asthenia, anxiety, again, the diagnosis can be found on the mednaukaint.net website. Here, it is a matter of the person's willingness or unwillingness. Well, a person has the right to suffer if they want to. The question is in the fact that if others are also suffering, if his professional activity is suffering, because with non-psychotic disorders in general, there are methods for assessing the psychophysiological state. Without biased opinions, without diagnosing it as depression or asthenia, a person's reaction speed and thinking pace actually decrease. This is determined by objective, absolutely objective tests, and this can already affect his professional qualities, his ability to perform his work, and this can also pose a danger to others if the person is employed in some kind of production. More details about this can be found in the section of the Mednauka website. The point is psychiatry for managers. So, in order to navigate this sea of non-psychotic disorders in this abundance of diagnoses, and to be able to distinguish a non-psychotic disorder from a psychosis, what requires immediate response, and what can be left to a planned, non-urgent decision by the patient themselves, we need to understand the issue of mental illnesses. Let me conclude here. Thank you for your attention. All the best to you.